Hello, good afternoon. Today's topic is trigger finger, one of the most common problems which we encounter in orthopedics. So, a trigger finger is a condition where finger, thumb, or get catches or clicks in a bent position. So, whenever you flex your finger, it gets stuck in this position. And when you want to extend it, it won't extend it freely, and you have to make a clicking sound. You get a clicking sound. That's why it is called trigger finger. When you fire a pistol, you usually press it like that. So when you press it, you can't take it out back your finger very easily. So that's why it is called trigger finger. So it gets catch. What happens in that? So what are the risk factors? Trigger finger occurs when the sheath of the tendon becomes inflamed and thickened, making it difficult for the tendon to slide through easily. Repetitive motion activities involving repetitive gripping, grasping, or vibrating tools, and also diabetes, rheumatoid arthritis, gout, or thyroid conditions, most common in women, and also age between 40 to 60 years old. Other factors include hand surgery or any injury, so where scarring is formed. Symptoms: a locking or catching sensation, particularly in the morning, stiffness or a snapping feeling when moving the finger, a tender lump or nodule at the base of the finger in the palm, and painful, tender, or swollen palm. So, whenever you have a trigger finger, you will have thickness here and pain mainly when you have pain over here. When you are trying to make the movements, you will have pain. So many people will misguide the doctor saying that they have pain in the PIP joint or distal phalangeal joint. But when you clearly examine, they will definitely have thickness over here and pain over here. So what are the treatment options? One is conservative methods, which restrict your fingers. So that is when we are restricting your movement. So we are restricting your overused. So we have to avoid this flexion so that it gets trapped in the A1 ligament, trapped in the A1. So second thing is if the swelling is more and inflammation is more, we can give corticosteroid injections or PRP injections into the tendon sheath for reducing the inflammation. And then we will start a course of physiotherapy, ultrasound therapy, and IFT or the A1 ligament pulley with steroid gel so that inflammation is reduced and the tendon sheath becomes movement flexible. So when all these attempts are played, when conservative attempts fail, and even if you have a trigger finger, sometimes what happens when you get cured, you will get again after 6 months, 8 months. So when the frequency of repetition, the repetitive attacks is more, also we have to think of doing surgery. So surgery involves mainly releasing the tendon sheath, that is A1 pulley ligament. It is where the inflammation and pathology lies, thickening of the. So once you release this tendon, you will have a permanent relief of the disease. Very rarely you get any recurrence of the disease. Thank you.